they're going to have to report all their side effects. In some cases, that might create an advertisement that's 4 minutes long. Back prior to 1997, advertising in magazines had page after page after side effects reported. And so we don't know exactly what it will do, but we know it's going to be better for the health of Americans.
Health and Human Services Secretary RFK Jr. on Fox this evening talking about a brand new memorandum regulating how pharmaceutical companies advertise prescription drugs. This is part of RFK's 19-page MAHA strategy report aimed at making America's children healthy again. It essentially puts into words strategies and theories RFK Jr. has been promoting for years. With us now, Commissioner of the FDA, Dr. Marty Makary.
Good to be with you, Leland.
Pleasure, sir. Go back to 1997. What does that mean?
Yeah, remember the days when pharmaceutical ads were rare. One of the reasons was that because of the regulation that they have to present a fair balance of the pros and cons, they had to have a lot of information about the side effects. Well, in 1997, there was a loophole created with a reg that said they can put the side effect information somewhere else. They don't have to disclose it. Ads started becoming more common. You got more and more expensive drugs. Drug companies went hard. And now you've got some TV shows where, quite honestly, it's a nonstop running drug ad with.
Okay, we're not going to knock drug advertising here. It is an important part of the industry, I might say.
Yeah, it's part of free speech, and they're entitled to advertise. We have regulations at the FDA that say they cannot create a misleading impression, and they have to provide a fair balance. And we're going to say now the side effects have to go in the ad. They can't put it somewhere else. No one's enforced these regs. These regs have increasingly had enforcement that's been lax over the years, to the point where in the last administration, in 2023, there was only one enforcement letter sent by the FDA, and last year it was 0. Today, I sent out 108 enforcement letters, which were cease-and-desist letters to the companies, and we sent out.
So what are you saying in these letters? That your advertising is misleading, it's wrong? What is it?
That's right. It's violating our regulations. It's creating a misleading or false impression. It's not listing the side effects appropriately. I mean, you're watching people singing and dancing, and then you think, wait, did I just hear sudden death? I mean, they're not.
Well, so long as they say it, it's okay, right?
Well, they have to give a fair picture of the medication. We've got online pharmacies that don't mention any side effects whatsoever. We've got paid social media influencers that are paid by the pharmaceutical companies, essentially advertising a drug. Studies show side effects are mentioned less than a third of the time.
New York Times, Kennedy releases childhood health report. It's vague on next steps. For all Health Secretary Robert F. Kennedy's high-profile moves over the last few weeks, a new report from the Make America Healthy Again Commission he leads, released Tuesday, arrived with little fanfare or teeth. Sending a social media influencer a letter is a little bit different than sending somebody who's advertising on Monday Night Football, right? Is this actually, what has changed in America over the past 6 months that make us healthier?
Well, it's funny you mentioned football. There was one analysis that showed you're watching more pharmaceutical ads than you are football plays when you watch a football game in some instances. We're not sending the letter to the influencer. We're sending the letter to the pharmaceutical company because we have regulations. They haven't been enforced. And this is something that almost every doctor is united around. We as physicians don't like the nonstop barrage of ads that create a false, misleading impression. They're increasing demand for medications in a culture where we've got a pill-popping society mindset.
My mother would call it better living through pharmacology.
Well, the thing is, there's no sense of what the appropriateness of these medications. I mean, sometimes you watch them in these ads, and you don't even know exactly what it's for, but you kind of want
that. You're going to get longer eyelashes, and then halfway down it says, and you might die.
Something positive. You think, I'll give up. I'll take it.
Right. Okay. So this is an important question, though. I think the New York Times makes a point here. 6 months into the Trump administration, how is America healthier?
Gosh, we have done so much in 6 months. And I didn't read that article, but there is so much spin. If we literally approved the cure for cancer at the FDA, you'd find some negative spin given how polarized the media is today.
Probably fair.
We have done a tremendous amount in 6 months. I've been at the FDA for 5 months. We have removed petroleum-based dyes from the U.S. food supply. We've got an inventory of all
Are they actually gone, or they're on their way?
We've got
commitments
and
okay.
hard commitments that we follow on our website. We are rewriting the food pyramid, a piece of misinformation that wouldn't allow some schools to have whole milk. We are ending the 50-year war on saturated fat. We are doing an inventory of every chemical. We're removing the GRAS standard, and we've initiated that regulation change, so you can't just put whatever chemical in your food you want as a food maker. We are having a new process to make drug approvals more streamlined and modernized because we want to deliver more cures and meaningful treatments to the American public. And we have called out vape stores and what's in those stores. It's been a very busy 5 months.
So you're saying that there are marked ways that American lives are healthier?
We're taking steps to change the entire conversation. That MAHA report today, which I would encourage everybody to read at the White House website, has 128 specific things that we want to put front and center in American healthcare because we've never really been talking about them in traditional medicine. The microbiome, food as medicine, micronutrients, the importance of soil and where you get your food, microplastics, natural light exposure in children. These are things that affect mood. Screen time affects the amount of ADHD meds that are prescribed. We have got to look at patients holistically, and we've got to talk about root causes. You're seeing a whole new slew of research grants come out of the NIH to talk about root causes for the first time. It's an exciting time. We're resetting that national health agenda. The MAHA report explains exactly how, and we've been very busy at the FDA.
Doctor,
good to see
you, sir. Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.